Hi, I am Dr. Prashanth BN. I am an arthroplasty surgeon working at Narayana Health City, Ortho, Spine and Trauma Center. So, reverse shoulder replacement, like what we do for knee degeneration, what we call knee replacement surgery, there is a surgical entity called reverse shoulder replacement, which is helpful for a patient whose shoulder is degenerated or there is cuff arthropathy. Secondary to rotator cuff injury, there is a degeneration in the shoulder which is called cuff arthropathy. These people are benefited by reverse shoulder arthroplasty. So, reverse sense, normally the glenoid, it's a cup shape placed on the scapula side, and humerus, which is a ball shape, which is placed on the humeral side. So, in reverse shoulder, the position reverse means the cup part comes on the humerus and the ball part comes on the scapula. That's why it is called reverse shoulder replacement. So with reverse shoulder replacement, there are few mechanical changes which happens, with which there is no need of cuff muscles to be active for shoulder abduction. So which is carried out by deltoid muscle, which is normally intact in most of the people. So that's why slowly this reverse shoulder arthroplasty is gaining its popularity and it is becoming one of the successful surgeries.